So I guess most folks have to think that America has like the world's best like healthcare. Oh, America's healthcare. I remember like the affordable healthcare debate, right? Where everybody's like, oh, we have great healthcare, America, great, yeah, hear us roar. Well, the truth is that all those individuals were wrong. America, according to the Commonwealth Fund, is 11th. 11. There's 10 other developed nations that have better health care than we do right here in the US of A. Now, here's a couple of statistics that are going to blow your mind. Statistic number 1. Patient satisfaction is at an all-time low in this country. 2. Medical errors at an all-time high. Infant mortality is worse in the United States than any of the other developing world, and so is life expectancy. America's reputations for efficiency is also shattered. Both American patients and American doctors report spending an unusual amount of time on paperwork. Yes, indeed, America, it is true. Right? So we have low life expectancy, we have high infant mortality, we have low patient satisfaction, we spend way too much time on paperwork. Now, what is that saying to you? Well, it's saying a couple things. One, out of all of our competing countries, we're one of the few countries that have commoditized healthcare. Because healthcare is so privatized, and it's based on insurance and profits, this, that, and the third, and because we don't have a single payer system, folks, you create a situation where, since it's commoditized, the commoditization of it is why it's not effectively done. We don't have economies of scale. Not to mention the fact that because not everybody has healthcare insurance, even though the Affordable Care Act has been a huge step in the right direction, corporations run our healthcare system. And a lot of these other places, it is run by government, where there is economies of scale. Everybody gets served, no matter how rich or how poor you are. You get to get prenatal care, right? You get to get, you get to get health checks, health screenings. Not to mention the fact that in most of these countries, you have like a 30-day vacation. So life expectancy is low in America because we work like cats and dogs. We work like a dog, and then we don't get any returns on the back end. America, if we want to truly fix our health, first thing we got to do is we got to understand that our healthcare system is a health insurance system. What we need is a national healthcare system which is not focused on profits, not focused on who can make the most money, but as a healthcare system that is focused on making sure that every American has access to life, liberty, and the pursuit of happiness. And the pursuit of happiness means healthy happiness, folks. Not worrying, not having cancer, and then as soon as you recover from cancer, getting a $40,000 bill and trying to figure out how to pay for it. Now, you might not have cancer, but I guarantee you this, you might have a stomach ulcer or two. This is the fundamental problem we have as a nation. We've got to change the conversation away from healthcare insurers and change it to how do we make sure that every American gets the best healthcare possible. Right? Now, I'm not saying that our healthcare system is failing, but the problem is that we're not even looking for cures because all the health companies care about is making profit. But if you had a healthcare system that was focused solely on making sure people stay healthy, scientists would be able to literally sit there like, how can we cure cancer? But instead, these folks, doctors, trying to figure out how can we bill Medicaid, how can we bill Medicare, and how can we bill the insurance companies to keep a roof over our head and keep our doctors' or doors open. Big problems, America. Big problems.